Hello, how are you doing?
I'm fine, thank you.
I'm wondering if you can introduce yourself and also tell me a little bit about yourself personally and professionally.
Okay, my name's Lorne Zon, and I've been involved with Ellies Place since day one, prior to it even being incorporated as an organization, for a number of reasons. Both I understand the issues going on with mental health because of my professional career, and also because I'm aware of the Coopers and their children, and we've known them since they were children. By background, I spent 45 years in healthcare, mostly in administration at both the provincial, local, and organizational level, from hospitals to community agencies. I've been the CEO of about 8 different agencies. And most recently, at the end of my career, I was the CEO of Canadian Mental Health Association. So I certainly had a good opportunity to see what was going on in the field and where the gaps are. And I do believe that what Ellies Place is trying to do certainly is filling a considerable gap in the system right now.
That's amazing. I love the breadth of your experiences, and clearly, off the top of our conversation, I can already see the passion that lies within everything that you've done with your career. Very inspiring. I guess with that being said, what motivated you to volunteer for Ellies Place all these years so far?
Well, two key reasons. Within my career, I've spent about 20 years of it involved with mental health, both at Canadian Mental Health Association, but in other organizations as well. And I've really seen firsthand just not only how devastating it can be to individuals and families and communities, but also that there are a lot of gaps in the system. And when I first heard about Ellie's Place and what they were trying to do, um, as we say when we talk about Ellie's Place, it is something that does not exist, not only in Ontario, but in Canada. And yet we've seen this kind of model work successfully in other parts of the world for decades. And so the opportunity to bring that innovation here was quite exciting.
Out of curiosity, what do you think will be the main differentiation point between Ellie's Place and the system and the current system right now?
Two key things as well. One is many of the programs that are out there right now are fairly short term
Mhm.
in terms of the residency part. They're usually 3 week, and then follow up with community care. So the fact that Ellie's Place is going to be providing much longer term residency to individuals, I think is really important. And the other is that often the mental health services will concentrate on the therapy, and if you need employment counseling, you have to go someplace else. If you need general life skills, you need to go someplace else. And at Ellie's Place, we're trying to bring all of that together so that I think it will really make a big difference to those who attend in terms of being able to get back into the community successfully.
I completely agree. So, what would you like to add to this conversation around mental health?
Well, I guess the other thing I've seen, having been part of the healthcare system for such a long time and having been part of the mental health field such a long time, is that mental health services, the issues surrounding mental health, have always been seen as a second tier service. Physical health came first, other stuff would come second, third, and fourth, and then you'd kind of get into mental health. And there seems to be a shift now into recognizing mental health as just a health issue that needs to be dealt with the same way as other issues. The other thing that I'm seeing that I'm delighted about is the issue of stigma is being raised, being talked about, and I think there's been a lot of progress made in terms of reducing the stigma around mental health, and that does a number of things, both for the individual, but also for the ability for people to give and governments to fund mental health services and be seen as something that's important to do.
For sure. I love how you touched on this point of stigma, and I was wondering if you can elaborate a little bit more just based off of the line of work that you've seen, everything that you've seen, and kind of what has been happening in your eyes, and why is change so required right now in the world that we're
One
living
thing that really struck me when I was at CMHA, we had hired a public relations firm to help develop an anti-stigma campaign. And this was a fairly large firm, and the chief people in charge of the program had a number of people in their family that had mental health issues, and they were quite attuned to it, and they were really eager to work with us. And they were in a general meeting one day, and they told us this story, and they had about 200 or 300 employees at this meeting. And they asked, how many people in here have either had a mental health issue, have somebody in the family who has a mental health issue, or has a friend who's had a mental health issue? And about 5 people put up their hands.
Mhm.
And statistically, we know it would have been 20 times that. And I think that was a key example of stigma, that even in this protected environment, people were not only willing not to talk about themselves, but not to talk about people they know or family members they know who might have a mental health issue. And I think that really showed stigma is out there alive and well, and we have to fight that.
Sounds like a very eye-opening experience for sure. Thank you for sharing that. So I guess our last question, what does our Ellies Place tagline, "Where recovery grows," mean to you?
Well, again, having been around mental health for a long time, recovery is the key word. It's not cure, it's recovery. And it's learning to live with whatever mental health problems you may have. They're not going to go away. You don't get over it one day. And I think that's where I like the tagline. It's not about you're going to take a pill and get better. It's recognizing that mental health and your ability to cope and your ability to do and be productive is something that grows and changes throughout your life. And I think the tagline because it has that kind of momentum to it.
Lovely. Well, thank you so much for your time. I think your insights are definitely very valuable, and your passion in mental health is just exquisite. And I think we had a great discussion, and Ellie's Place is definitely very, very lucky to have you. So thank you again.
Well, thank you very much.